Hello, everyone. I'm Dr. Diana Bitner, co-founder and physician at True Women's Health. Tonight, I'm here with Amy Chambers, and we've got a lot of good information to get to tonight. So let's get started. Tonight is our Let's Chat that we do frequently, and tonight we're talking about the economics of healthcare. So just like I tell my patients at the office, you, the health consumer, are the boss. I'm not the boss. I'm not your mom. I am not invested necessarily in what you do, but I'm very invested in you knowing your options, the pros and cons of any treatment, including what we're going to talk about tonight, the pros and cons of the cost of your health care. At the end of the day, what you do is your business. But I want you to know the pros and cons, but also I want to be your partner in your journey to whatever that goal is. And in order to provide such care and service, I started True Women's Health. And I want you to make the best decision about your health care from fact, not fear, not fiction. So in order for you to make the best decision about what to do, I wanted you to better understand the economics of healthcare. I am not the expert in this area. Hence, I invited the expert, Amy Chambers. Amy Chambers, thank you so much for being here with us tonight.
Oh, it was my pleasure.
So I've known Amy in the West Michigan healthcare community for over 15 years.
Mm-hmm.
Amy got her law degree from U of M. And Amy, do you want to tell us more about your background?
Sure. And hi, everybody. Is there a little bit of an echo? Can you hear that? Nope, it's good. Okay. So I thought I heard it for a second. So I hope everybody had a great day today, and I'm really looking forward to spending some time this evening talking about the practice and the economics of healthcare. So I have been in insurance for 30 years. It's hard to believe sometimes. I've been an employee benefits attorney for 24 years now. I actually came to town to work at Warner Norcross, where I was an employee benefits attorney, and I spent 10 years at Priority Health, where I, for a period of time, ran product development. So I designed all the high deductible health plans that we know and love and use today. So I wrote HSAs for Dummies. So I'm well acquainted with the financials of healthcare. And in fact, for the last 10 years, I've been an entrepreneur and in startup. And I have a company now I co-founded that's called HealthBridge Financial. And I help people manage and pay for their out-of-pocket costs. So I definitely have a lot of experience with the economics that we're going to talk about tonight. I would also add that I'm a patient. I like to think that I was one of the first people to sign up. I was very excited about it. So I've been seeing Dr. Bitner through True since last July. And also, just to be clear, I'm not being paid for this tonight. And I'm just going to talk a little bit about how I made the choice, and then also how I did the math on this, and just to give you some ideas on how you might do the math as well.
So Amy, you were excited to sign up. Now I am hearing the echo as well.
It goes away. It goes away after a few words. So
okay, good. Sorry, everyone. Let us know. By the way, everyone, you can leave your comments or questions in the page, and we'll see them. We can answer them as we go, and or you can put them in after the fact if you're not watching this live, and we'll get back to you, I promise. And if the sound is not good, please tell us that as well. But basically, Amy, you had a sense I was doing this. You learned more about True. What were your expectations? What made the decision for you? I'd love to hear you talk about that.
Sure. Well, I obviously thought a lot about it before I came on this today. So, I would bucket why I joined True into kind of three categories. The first one is I decided last year that it was time for me to make time for my own health. I work a ton. I'm an entrepreneur. I'm a wife. I'm a mom. And anybody who knows me knows I run at life pretty hard, and I never take time to take care of myself. And what I was finding was that I started to amass all these little issues that were starting to impact me, but I ignore them. I'm too busy. I don't have time for myself. And it started to impact my overall well-being. And then it started taking up a lot of mental space. My dad died 3 years ago and from cardiovascular disease. And I think that was a little wake-up call for me that, I really did need to start taking care of myself if I wanted to have the picture of myself in the future that I had always hoped for. And I guess I would also put, there's kind of that was A, and here's B under this. I'm 51 and I am perimenopausal. And there's a lot of things that I love to research. I love to research exercise and I love to research nutrition. And Dr. Bitner knows all that stuff. What I don't want to spend my time researching is menopause. It's just not an area of interest for me. And I know I know you love it. I was thinking, who do I know? Well, I will hire experts in every part of my life. Like in my job, I am known as somebody who will not do the work herself if I know that there's an expert out there that I can hire. I just don't do it. It's not a good ROI for me. I don't get good results. And this was a no-brainer for me. I'm like, I'm entering menopause. I don't know anything about it. I don't want to research it. And I just need to go to the best. And I've always known you to be the best. I followed you for years. And I thought, okay, if I'm going to make time for this, I'm going to find an expert. So that's the first reason I did it. The second one, and I'll just go over this one pretty quickly because we're going to talk a lot about it. It actually made financial sense for me because I knew that I was going to really delve into a lot of healthcare in the next year, because if I'm going to get this done, I'm going to get it done now. I'm not going to string this along. And I thought this financially was smart for me. And we'll go over that a little bit more. And, the third reason is a little more touchy-feely. And I think I was telling you about this the other day. And it was that I had this revelation that I deserved the best. When it came to my healthcare, I deserved the best. And I was thinking back to, it was about 2 years ago, and I have a lawyer that I use a lot in Minneapolis. And one day I'm talking to him on the phone, and he says to me, I'm so sorry about the background noise. I'm at Mayo. And I was like, oh, I'm so sorry. Like, don't take this call. Like, if you're at Mayo, don't worry about it. And he said, no. I come to Mayo every year for 3 days and I do a full workup. I do an executive physical. And I said, oh, well, I was thinking, well, maybe he has something wrong with him. He says, no, I do this because my wife and my kids have told me I'm so valuable to them and I've designed this great life and they want me around for a long time. And it stuck with me because I thought, man, I am valuable. I'm valuable to my family and I'm valuable to my coworkers. And it's funny because I have actually designed and opined on so many executive wellness programs for other people. And I never thought about it for yourself. No, I just didn't think I'm not worthy of it. And that's just something in me, that's for other people. And that's when I saw True, I was like, this is my turn. It's my turn. So that was the final straw for it.
No, I love that. And when two things really stuck out for me. Number one, your dad who had heart disease,
Mm-hmm.
and so many people that develops very silently and you don't know about it until it's too late, until you're in the hospital with chest pain. And so it's I want people to take an event that means something to them and flip it to the positive and say, I don't want to have heart disease. But
Totally.
You can't have that happen unless you have that goal and then, of course, know what to do to get there.
Mm-hmm.
And then the other thing that struck me is, you're starting to enter a phase of life that all of us will do, no matter if it's at 30 or 40 or 50, or I have a patient 59 and she's still having periods. So, we all have different ages when it's going to happen, but it happens. And it can be that confusing time of, I don't have time for this.
Mm-hmm. Exactly. That's what brought me to you. So everything kind of culminated. And so I'll tell you a little bit about how this experience was. I'll kind of start at the beginning. I'll start back in July and how this experience was even better than I thought it would be. I'm sounding a little salesy, but I don't mean to be, but I've just really cherished the time that I have spent in the practice. So when I first came in, I always remember it's a beautiful place, and it's a very different experience. And but I was still my old me. So I remember the first time we sat down together, you started to do your workup, and I was acting like the patient that I used to be, that had a 15-minute GP appointment. And like, you would say, how's this? I'd say, fine, that's fine. Oh, I'm fine. Like I'm trying to get an A on a test or something like that. Oh, everything's perfect. And because you are who you are, and because of the time that we allowed for this appointment, you really you slowed me down, and you said, all right, you're here for a reason. And you put me at ease. And I remember I unpacked everything, every little issue that I would have never gone to a GP for. I would never have talked about it in my 15 minutes, because what you do is you prioritize. And I'm of the mindset that there's much sicker people in that waiting room. I shouldn't be taking up healthcare time. I can live with this stuff. And we literally went through every single thing. And I will never forget, you assured me that we were going to address all of them. And that's what I always remember. I was like, I'm actually going to tackle all of these things that I have never tackled before, I've never addressed, and I probably never would. So until it was probably too late. So that was very different for me. And I guess, and I have a little bit of, I'll just say that without diving too deeply into my healthcare issues, I wound up, number one, addressing one particular issue that I just thought I was going to live the rest of my life with. And we've already taken care of that. And then the second one is you detected an early stage issue that would have eventually become cancerous for me. So when I was talking to my husband the other day about True and doing this, and we both decided that even if I was a member at True for the next 50 years, it's already paid for itself. I mean, just you finding that, and I've got a shot at a really great next 50 years. It made it all worth it.
What's the next 50 going to be like? We're diving into the next 50.
I know.
And you're prepared. But I love that concept in terms of what is the cost of deferring care? Like you said at Priority Health, you would talk about what is the cost of that heart attack that never happens. And many physicians like myself who are really interested in understanding someone's goals and someone's risks, we brag the fact that our group of patients has the lowest rate of heart attack, the lowest rate of diabetes of any group of patients anywhere. And I'm so proud that we're right there. So many patients come in and they already have prediabetes and they don't know it, or they have other conditions, and we're able to find them early before they even walk in the door. How did it affect you that you already had your labs drawn before you walked in the door?
Oh yeah, well, the whole concept of skipping care is so part and parcel of healthcare today. I mean, I work on that issue with my current company. We obsessed about it at Priority Health, because what insurers and providers really want most people to do is get the right care at the right time at the right level. But skipping or delaying care is the norm. It's just the norm. And I think it's kind of intuitive that that's a bad financial decision. It may seem right in the moment, but long term, it's not a good financial decision, because we know that. So I'll go into some of the statistics that I know. When people skip or delay care into the future, necessary care becomes 3 times more expensive. So it's like 321%. So the actuaries will tell you that. That's why you don't want to delay care, not to mention the outcomes, just your general well-being. A lot of skip care goes into that parade of horribles, like, mortality, morbidity, disability, just long-term issues if you had just gotten things taken care of up front.
Exactly.
And a lot of it has to do with, well, there's lots of reasons that people skip care, but the one that I usually focus on is the money part, because that's my job. And we know that 2/3 of all Americans skip care because they're on a high deductible health plan. And I call it genie in the bottle syndrome. If I go to a physician and I let the genie out of the bottle because I say, let's start working on this health issue I have, or I tell you about a symptom that I have, in a normal healthcare setting, if you have a high deductible, you're thinking to yourself, if I have to go see a specialist and I got to get radiology, or if they get a lab, and I just have no idea what the total cost of care is. I have no idea.
It's scary, so I'm just not even going to bring it up.
It's very scary because, number one, like, what's it going to cost? I have no idea. And healthcare has no idea. And I understand why. There's a lot of reasons why it's hard. There's not a lot of price transparency, and you don't know until you dig into it. So that's one of them. Second one is, once I know what it costs, can I even afford it? And then lastly, there's some of it that's, do I even want to pay money for this? Is the juice worth the squeeze? So if I get in halfway, is it money wasted if I say, I really don't want to get this taken care of? So that makes me, I'll bring it full circle in that the concierge model, and this is a concierge model, makes sense from the perspective of skipping care, because people don't skip care when they have already paid for it. So I'm going to fully utilize, I've already seen you 6 times. I'm going to fully utilize that healthcare. I'm not going to skip care. I'm not going to go back later and take care of it in the future when it's 3 times more expensive for me. I'm not going to have a worse outcome because I'm going to come in now because I already paid for it.
And what's so great is another patient I think of, she sees us probably maybe even every week.
Wow.
But what she's accomplished in these last 3 months, she has already added years onto her life. A patient I saw today, I mean, again, it's just like, it gives me tears in the moment with these patients, because they're like, they get their twinkle back. They turn back the clock, they drop their A1Cs, their blood sugar levels, just by these good common sense tips and tricks. And the other thing is that we can really, I always tell my patients, my number one goal is to keep you safe. And so if we do have a hierarchy of making choices about decisions, medications, evaluations, number one, I want you safe. And when things are more quality of life, maybe there is more choice about what you spend on the extra tests, the extra evaluations, but I want to keep you safe. And so we're also smart about it. I'm not just going to order a bunch of stuff. You're going to know why I'm going to order what I'm going to order.
Oh, yes.
And then I'll spoil you. We'll make sure we do as much as digging as we can for you to say, this is what this is going to cost, and this is what you can expect.
And I found that all to be true. So why don't you take a minute and tell everybody about the membership model?
So at True, we really wanted to keep things simple. And again, as a physician, I just like to take care of my patients. I don't like to think about all this, but this is how we make good care happen. So at True, we offer 3 essentially membership programs. There are 3 wellness programs. There's the complete wellness program that is $200 a month. The basic wellness, that's $50 a month. Think about how much you spend on coffee, right? And then the cancer wellness program focused on cancer survivorship. And this is headed by Suzanne Pettigrew, our PA, who specializes in cancer wellness. So these are our 3 wellness programs. And in terms of a bit more detail, with a complete wellness, it's unlimited visits. And so again, to your point, if you're paying for unlimited visits, we hope to see you a lot. And included in this is a visit with our nutrition coach, and is for all these patients, use of our True app. Again, one thing I think about cost of care is the time spent. I was on hold with a doctor's office 40 minutes, and I finally just hung up. At True, you text us on the app right away. We get right back to you, and that's 24 hours a day. Our whole team sees it during the day. Suzanne and I see it at night. And so it's just really quick access. At True, we also provide you a book guiding our care, a workbook, and a journal that we hope you bring every time to use to guide along your healthcare journey. We use a tool called the Life Map, where we where we chart your goal and then we chart your progress toward that goal. So again, it's all this guidance for these 3 different options. How's that as a good setup?
I liked it. That was great. So I might talk a little bit. So you mentioned before about the interplay with insurance. So you got the membership,
right?
You get the membership, and then the idea is we maximize. I'm talking like we, like the patient and you and your team will maximize your insurance benefits.
Correct.
So when I get, oh, I see some. My mom's husband's on there. So hi, Mark. It's so nice. I've got some of my friends out there. So what we have done is my labs will go through my insurance. You're still going to use your health insurance benefits. I'm still on BCN. I have a BCN plan. I still have a PCP. I happen to pick a PCP that's with Spectrum Health, but you can have your PCP with anybody, my understanding. I have access to the whole system, the whole healthcare system, including you, which is great. And also all of my visits with you go into my chart. So having that in my chart is great. So when I will go see somebody, maybe at Spectrum, it's all in there as well. So
by that you mean Epic. So what that means,
Epic.
right? If you have tests that are done at Spectrum, at Metro, at St. Mary's, we can see everything that's done everywhere. So it's really easy. We're a Spectrum Health Epic affiliate. And so we have easy access to all the records. And again, if you were to see your PCP, they can see exactly what we're doing. A patient I saw recently, we diagnosed her with prediabetes. We started treating her. Her primary care doc sent me a note. Hey, I see what you're doing. Love what you're doing. Good work. We want to be very collaborative and work together with all the healthcare, in town.
Yeah, no, and that's been very handy for me because I have gone back into the system and used my benefits. So obviously you want to keep your health plan because you use it for catastrophic coverage, and you also use it for all the things that fall outside of what you would get through an appointment at True. So I get my flu shot at Spectrum Ada. I've gotten my shingle shot. When I finally get the COVID shot, I'll get it there as well. I've done all my labs through them. So everything has gone through my insurance to date. But the way I think about you is you're my quarterback. I spend all my time with you. You're my quarterback. You call the plays and I run them. And wherever I can use my health insurance benefits, I use them. And anything that I can get done by you, through you, and you actually have a very broad spectrum of services. And so whatever I can get through you, I just get through you.
Yeah, we really do want to be your one-stop shop. And again, between myself and Suzanne, who's done primary care for 30 years, I want to be your one-stop shop for a cold, for a bladder infection, for a vaginal infection, whatever it is, just to make it easy. And again, we have same-day access. You text us in the app, and you're in to see us soon after. So we really enjoy being that, really easy. And as your lab work comes in, then it's incorporated right into your plan.
Yep. So if you have, so let's talk a little bit about HSAs, HRAs, and FSAs. Three sets of background.
Just real quick.
Yeah.
Go back.
Yeah.
What we didn't mention with the complete, that's $200 a month. With the $50, the basic wellness, $50 a month. Then of course what happens is once a patient comes in, that individual visit is billed and a receipt is given because they've paid at time of service.
Right.
So because they pay at time of service, they're given a receipt that they can turn into their insurance, right? Or out of network provider benefits. Is there anything you might want to offer about that?
Yeah, well, I'll pick that up. Let's talk about that. So with the basic, I'm glad you have the words up there. So complete wellness is, that is a subscription or a membership. So those are usually not reimbursable under your traditional health plan. So I can't turn around to Blue Cross or Priority Health and ask for that to be reimbursed. That's generally not reimbursable. Same thing with the $50 a month for the basic wellness or the cancer wellness. Again, membership fees, not reimbursable. Yes, but under the basic wellness, for the cash payments for the actual visits, yes, they can, under some plans, be turned in and be counted against your out of network. A lot of times out of network will have its own deductible. So you might just be chipping away at the deductible. Sometimes there is some type of benefit that you might be able to get reimbursed for. It all depends on your plan design and the terms of the plan. Now, 201 is if you have an HSA, an FSA, or an HRA, here are some things to think about. An HRA, I'll start with the one that most likely won't be used. So an HRA is a health reimbursement arrangement. That is a little money bucket that your employer puts money in and usually helps pay for your in-network deductibles and things like that. Anything that you get done at True, for the most part, probably won't be covered under an HRA, just because those plan designs and what an employer wants to reimburse you for is usually pretty narrow. But if you happen to have an HRA, then you may just want to ask them if anything is reimbursable under an HRA. But again, I mean, not a lot of people have them, and in most cases, it wouldn't be reimbursable. However, FSAs and HSAs are a little bit more interesting. So I think we're used to those classic FSAs, flexible spending accounts, and that is where you usually put money in on a pre-tax basis for the year, and it allows reimbursement of medical and prescription drugs, dental, vision, a few other things, but they're all medically necessary 213D expenses. We're all pretty used to them. I will tell you that membership, not covered by that. So you can't put the membership fee. I can't put my $2,400 fee in. However, what you can get reimbursed out, remember, it's your money. And employers can put money into FSAs, but most don't. But for an FSA, you can be reimbursed for those appointments that are directly billed under the basic. And if you're under the complete package, like I am, what True will do is at the end of the year, you get an accounting of all of your visits, and they're not you don't get a price per visit, but you would apply a rough estimate of the cost. So the usual and customary or reasonable and customary in the area for that service. And True's going to do this at the end of the year. I'll help them do this. And at the end of the year, you can kind of get an accounting that may actually be reimbursable out of your FSA. So let me give you an example. I've gone in, yes.
For example, a procedure, an endometrial biopsy, placement of an IUD, a pap smear. Like, we have all that coded in the chart, and then with guidance, it's having that form.
You got it. So I may have paid $2,400 for my membership, but I got $4,000 worth of services, right? I can actually put in that case, I would only be able to put in up to $2,400. But if I got $2,000 worth of services and I paid the $2,400 for the membership, I could get reimbursed for that $2,000. So that's for your FSA. And again, there's plan rules that usually are, that will guide you, and you need receipts. You send it into a third party, they reimburse you. Now, HSAs, if you have an HSA, even if you had an HSA with money in it that you put money in a few years back and you're not on an HSA plan anymore, you can use your HSA money anytime, as long as it's for medical or prescription drug or other reimbursable 213D expenses. Now, when I teach people about HSAs, what I usually say is, those are your own accounts. And anything that you reimburse yourself for from that account is between you, God, and the IRS. So there's no third party that looks at receipts. It's just you. So the same rules will apply. If you have an HSA, you can't reimburse yourself for the membership. I'm saying that. Again, it's between you guys and the IRS. However, you can do the same thing where you get the accounting at the end of the year. Here's all the services I got. Here's the cost. And then you can reimburse yourself for that. So the same rules that I was talking about on the FSA applies to the HSA. It's even easier because I'm not turning receipts into anybody for the HSA. Yeah, so next year I was even thinking, I usually let my HSA money roll because I'm going to use it when I hit Medicare one day, because that's one of the ways that you can use it. And but if I wanted to next July or whenever I re-up, I could actually do a look back, say, I've gotten $2,400 worth of care, write myself a check out of my HSA, turn it back around and say, sign me up for next year. So that's just kind of a clever way to use your HSA dollars to just keep perpetuating the ability to see you and True.
Very good. That
Any
makes
questions on, it's my favorite subject.
Well, I love how you make it so simple. We do get questions about this all the time. And Elizabeth at the front desk is getting very comfortable talking about this, but it's good to have this guidance and for people to be able to see this. Because again, we know, for example, people walk in with their HSA credit cards and want to use it. So for the time of service, like let's say there's a basic wellness program, or they're in the basic wellness program and they want to pay for their visit that is billed at the time of service.
Oh yeah,
they can
definitely HSA. You absolutely can use your HSA card, whether you have a debit card or an HSA credit card or a checkbook, or if you just want to pay out of pocket at the point of sale, and then you decide when you get home, hey, I probably wanted to run that through my HSA, you just write yourself a check. So totally reimbursable. And
then we also have programs at True that we haven't talked about in the sense that they're not membership programs per se. It's the Empower program, which is that one-time visit for a woman 25 and under. Yep. And then also the Silver Wellness program, which is for 65 and over. And then there's a one-time cancer wellness visit. Again, those are billed at time of service. The medical coding is all done at the time of checkout and can be billed, and someone could use their HSA card at that time, correct?
That's right. Yes. And if I can just put a little plug in for that Empower. So it's for, what is it, under 26?
25 and under.
25 and under. So I actually had I asked permission from Catherine before I did this, and I had Catherine go in and talk to have an appointment with Dr. Bitner. It was one of those thorough, long appointments, and she called me on the way home and said, "Mom, that was the best doctor visit I've ever had in my entire life. I am," like, she sang your praises. She was just so overwhelmed by the amount of time and care that you spent with her. And she talked about everything. And what we were talking about this last night, and she said, "I feel like such an empowered patient. Like, I feel like this is what healthcare should be like." And she had never experienced that in her 20 years. And she said, "I will never not be an advocate for myself because now I know how good healthcare can be." So I just, I love you. So it was just like,
well, thank you. And, having especially young women come in and, number one, I don't want to scare them off from a gynecologist for the rest of their life. But number two, it's like to really unpack, like you say, to unpack all the details of things that they've never known how to ask, who to ask,
Exactly.
And to really unpack all that. They come in, they're nervous, and they leave and they're just standing and sitting taller. They're relieved, like, oh, why was I worried about any of this? And, even today, a patient left and just said, "Oh, I feel so educated." And that's, again, I can't believe I get to do this. And this is why I started True. So I'm so blessed.
Yeah, you're definitely touching lives. And I'm allowed to share this too. We were even, I accompanied her to a specialist visit, and it was a GI doctor, and I could tell she was a different young woman in there. And she basically said, "I don't want to leave with another prescription. Like, I want a game plan. We're going to work this out." And she came with all of her questions, and it was a different woman who was ready to take on the world. And so anyway, I really thank you for that.
Perfect. Thank you.
Yeah.
Cindy, hi, Carrie Farnham, by the way. You see
Hi,
the
Carrie Farnham.
But Cindy's asking a question, if you want to read that there.
So how would we know costs for blood pressure tests, pap smears, counseling, about health blood tests to use for HSA? Okay. So I think this goes to at the end of let's say at the end of the year, but I think you could probably get a receipt periodically or a summarization periodically of it. My understanding is because Dr. Bitner's office has all the coding for these things anyway, it'll crosswalk over to an estimate of a cost. May not, if you're in the complete plan, it wouldn't be the cost that you paid at the point of service because you don't pay any costs because you're just paying the membership fee. But if you were in the basic plan, it would actually have a cost to it. But regardless of whether you're on the basic or the complete, periodically, end of the year, here's all the services. True will put in the estimate for the services and tally them up so you can take the money out of your HSA. So that's how it would work.
And Cindy, for example, like a blood pressure test, we would code that. Let's say you were just coming in for a blood pressure test. There's standard and customary costs, and we'd code that as, let's say, a 99213 is the code, and that's a 15-minute visit, and there's a cost assigned to that. That's a standard in the system. A pap smear, again, standard in the system, either grouped as an annual visit, which we have a specific code for, 99296, or we have the pap smear itself, the cost. Pathology would bill you separately, but we know what we would bill for that annual visit with a pap smear. The counseling about health, again, we do that as a time-based visit. We have that coded. And a blood test, we can even call the lab and get a cost for that in advance. But then, of course, you would get a separate bill from Spectrum or St. Mary's, wherever that blood went. Now, we draw blood at True, and in the course of a day, we don't charge for you to come in and get your blood drawn. But then that blood gets sent to the lab, and the lab would bill your insurance directly.
Right.
So I hope that answers your question.
So I will just, I wanted to do just one more thing and kind of show you, so this is a little 201. I happen to be on an HSA right now, and a different way to do the math. This is how I'm thinking about this as an HSA person. Out of pockets for preventive care, if I were not part of True, my preventive care visits would be $0. So under the ACA, the Affordable Care Act, all the preventive care visits, this is a while ago, were made free. So $0 copay. It's a very limited list. I shouldn't say it that way. It's a long list. I always say it's a mile long, but it's an inch deep, because these are supposed to be just overall general health check-ins. Very basic. And if you start talking about anything that has a diagnosis, if they code anything with a diagnosis, it's suddenly
a rash, a discharge,
all that. Yeah, you have just moved yourself out of, because the preventive care all has V codes, but and it goes through the system easily, it's $0 copay. But as soon as you have diagnoses, it heads towards your deductible. So that's the problem with a lot of these preventive care visits. You go in and you try to stay within the guardrails so you don't get charged. I know I used to do that too. That's why I was fine all the time. I'm fine. But so as soon as you have anything that you really want to talk about because you got symptoms or whatever that is, that goes to the deductible. So for somebody who is in a high deductible plan, this is how I think about it. Most years will live sub-deductible, which means that I don't incur enough healthcare services during the course of a year
to
hit my deductible. I never hit my deductible. Every roll of the dice, every 5 years, maybe I'll have something bigger, and I'll hit my deductible. But I'm like most Americans, I live sub-deductible. So this is how I think about this. I always say, I can do the math on this stuff. If I am going to, when I pay True my $200 a month, I know it doesn't track to my Blue Cross deductible. I know that. But if I'm not going to hit my deductible anyway, paying True versus paying other providers for my care doesn't make any difference to me. So I'll do that again, whether I pay true $2,400 or because I know I'm going to go after my health hard this year. I'm going to incur a lot of services because I'm going to fix everything. If I were to do that outside of true, I'm going to rack up the same amount. So whether I pay true and get expert service in an area that I'm keenly interested in with the provider that I adore, in a setting that I love, or I'm going to work around, the traditional healthcare system, I got the same out of pocket. So I might as well do the membership fee. And even if I have a bad year, so I have a bad roll of the dice and I have a big healthcare year, I'm okay having paid a little extra because I'm probably going to need somebody like you to help me guide myself through it. So that's how I do the math on the whole thing.
And that's what I love to do. When we have a patient who needs to see a specialist, we call same day, make that appointment for them. We follow through and make sure that you're satisfied, that the appointment was made, that what happened made sense, and then we use it to pull back into and continue to coordinate your journey.
Yep.
But Amy, I'd love you to read Denise's question off to the side and answer that.
So I'd love to receive this care, but my health insurance is over $1,000 a month for two of us, and our deductible is nearly $6,000. It's crazy. The cost is crazy. If your employer pays your health insurance fee, write them a thank you note. I feel for you, and you are 100% correct. So everybody's got to do the math for themselves. For some people, it makes a lot of sense. For some people, it's a little harder. So, but she's correct. That's people, particularly if you have employer-sponsored healthcare, where you're usually only paying 20 to 30% of the premium. Paying an extra membership fee is not a hardship. If you're paying the whole thing, if you're self-employed, you're paying for an individual plan, the math gets a little bit harder. But I might suggest that some year that you have the opportunity, if you have the opportunity to be on a more affordable plan, or if you can find the money, this could be an option for you, and you use the heck out of it, right? You get everything, because we talked a lot about, and I'm not here to sell anybody on it. Everybody has a different journey, but I still think I'll go back to the ROI on this.
That's what I was going to say.
Yeah, if it's pay me now or pay me later. So that's the way I look at it. I'm going to invest now. So in my later years, I don't have more expensive healthcare, and I'm not on 5 medications, and I don't have a bad quality of life.
And I would I so believe in what we do in terms of finding things early. So we do risk stratification in 9 areas of wellness. So in terms of, let's say, heart disease, if your deductible is $6,000, heaven forbid you ever need expensive tests, you're in the ER with chest pain, boom, you're up at $5,000 in a heartbeat. So it's really, how can we do little things now to make sure you don't have that down the road? And so again, to think about the cost of deferring care. So again, also, we all have different journeys, but we really are seeing this happen on a daily basis, that we're able to get ahead of things, start a low cost medication, not have to do big testing, and really get people on a plan. So in the following year, they're going to know what to do. I always tell people, I want you to not need me, in the sense of, if something happens, you know what to do. And that we've already made sure that your risk, let's say, of heart disease is low.
Well, what we haven't talked about is, if you are not healthy, the economic impact just from a work perspective. If I'm not my best self, I don't make money. Like I can't go to work. Absenteeism, presenteeism, that's a real thing. People they become disabled. They can't work because of these healthcare issues. And if you don't think that impacts your bottom line, I mean, that's part of the financial investment as well. My family wants to keep me at work. So go do this.
Exactly.
Stay well.
And, there was a study that came out in 2014. It was 2 physicians who looked at healthcare expenditures by Forbes 500 companies for women with symptoms of menopause and for women with treated symptoms of menopause. And what they found is that women whose menopause symptoms are treated had fewer doctor visits, fewer ER visits.
Yep.
They were at work more. They had fewer sick days, and they talked about better quality of life and better productivity. So it really is interesting that there is an economic benefit of being treated for menopause symptoms, not just you feel better.
Oh, absolutely. Well, you and I try to work on that years and years ago. I still think that, I think a lot of insurers are getting a lot smarter about addressing this as I don't want to say chronic disease, but disease management. And that is, it pays in spades if you can address those issues in a meaningful way. It keeps their medical loss ratios down.
Exactly.
So I'm looking at it says, how would a young woman pay for OB care by Dr. Bitner? So did you want to talk?
Yeah, so obstetrician directly. So I am an OBGYN physician, but I don't provide prenatal care or delivery care anymore. So if it's purely obstetrician care, that's not what we do at True, but we have great colleagues in town that I'd be happy to refer to. If it is general care in terms of care for a young woman, preventative care, health care, about sexual health, family planning, we do all of that. And I especially love the condition. I don't love that people have PCOS or polycystic ovarian, but I love providing the information around that. So, in terms of chin hair and acne, we love irregular periods, infertility. We love doing all that workup and evaluation, but then again, work with our colleagues in town that provide direct OB care. So I hope that helped, Kirsten. One thing I did want to bring up is that, I really do hope that someday we amass enough data to show that plans like this prevent illness. And, the paper that I published and that my book is about is the pilot study that showed that women who go through this process of care of goal setting and risk stratification and risk reduction really improves actual risk factors for heart disease. There is good data, and the more data we can collect, I would love someday this to be a covered benefit by an insurance, by whoever the payer is. So if executives from insurance companies locally are listening, please encourage the plans to think about this, because for a mere $50 a month, your patients could get really good direct care.
Yep.
And so again, we'll see how that works over time. Denise, thanks for asking. My book is called I Want to Age Like That, and we now have the accompanying workbook that goes along with this. So it's reading the book is about the method. The workbook will guide you through the method, and we'll definitely demonstrate what we do at True and give you that information to help yourself. It's on our website, truewomenshealth.com. And I think I just looked at our time. I can't believe it's been almost 50 minutes.
I know.
So what I'd like to do is to go into 5 tips that we came up with to leave you all with. And again, as you digest this, and if you have questions afterwards, please feel free to personal or private message us or message us in our Facebook page. So number 1, as Amy described, the math that she did, the math that I do personally for myself and my family, I want you to do the math. Do the math. How much out of pocket did you spend last year? And what did you get for that? So Amy, I don't know if you want to talk about that or if that's more.
No, I'm going to let you roll through them.
Okay, cool. So tip number 2, are you better off health-wise than last year? And so when I think about a 10, 15-minute preventative care visit you might get, so no disrespect to the primary care doctors, they're working hard, they want to do their best, but they're very limited by the script that insurance provides. One thing that patients will say about it True is that we go deeper. So we're able to take the time and the energy and we have the process to make going deeper easy. And so I would argue that patients who go through the True process or waypoints are better off. And I would wonder if you are. It's you go in for your visit, you might get a pap smear, a pelvic exam, they order lab tests, and then you get a email message or a postcard after the fact of, yeah, your cholesterol is a little high. Why don't you watch that? Mm-hmm. And whereas if your bad cholesterol is high, your good cholesterol is low, you have other risk factors, we might even order an additional test or talk about really specific details, have you see our nutrition coach, really get into the details of why you're eating what you're eating, and then really see your cholesterol come down. But that lab test is already done before you walk in the door. So again, I want you to ask yourself this question: are you better off? Number 3, how long was your appointment last year? So again, no disrespect to the primary care docs working hard to get all the patients through that they need to see, and to at least get the basic care to everyone. But if you're looking to learn more about your health, how can you do that in 10 to 15 minutes? And that's one of the reasons that I started True, is that we could do longer appointments. And again, it's that easy access. How long are you on the phone with your primary care office? How long, and are you talking to the doctor? Or are you talking to someone like playing telephone? They get the message to the message. Again, everyone's trying to do the best they can. But again, what kind of care are you getting in that? So tip number 4, does your doctor or healthcare team know your goals? So one of the things I love to ask patients is, what do you want? Why are you here? I'll ask a patient, when you walk out of the door, how will you measure success? When you get to your car and you sit there for a minute, how will you feel? What does success mean before we even start our appointment? And then what are your wellness goals? Why do you care? What do you want? And so we set that milestone. At True right now, we're doing a 12-week challenge where we're really focusing on people's habits, but all about meeting their goal. So again, do you know your goal, and does your healthcare team know your goal? And tip number 5, did you receive a personalized wellness plan? So we provide a personalized wellness plan that has what you want, where you are, what are the barriers, and what are you going to do about it? And that is something that we have practiced, is something that we really as a whole team feel very strongly about you having a good personalized wellness plan. So just to think about, have you gotten one? What does that look like? And is this helpful to your care? So Amy, any last thoughts?
Well, I was just thinking how fortunate we are in this community to have you. And I just look forward to kind of growing old with you and True. So I thank you for everything to date, and I thank you for everything going forward.
My pleasure. And thank you so much for sharing your experience with us. I know this is very personal. And again, I just so respect the fact that you, as a healthcare executive and professional that you are, and how you pay attention to detail, that you've figured out how this plan really is what I was hoping it would be. So thank you.
And more. You're welcome. Thank you.
We hope you all check out truewomenshealth.com and check out our Facebook, our Instagram, our Twitter for our next events coming up. So everyone, stay safe. Good evening. Have a good night.